with Stefanie. You can come on in. She is one of our Peds coordinators here in the emergency department, and we're going to talk about a push-pull method for IV fluids for kiddos. So if we can give rapid fluids to a kid. So I'm going to have her step in.
Hi guys, I'm Stefanie. I'm our Peds coordinator here in the ED. One thing we're going to talk about today is a gap that we've identified is giving fluids to kids rapidly. So I'm going to show you today how to use the push-pull method and giving kids fluids rapidly. One thing we've identified is that when physicians are ordering a fluid bolus, we're not always questioning whether or not we should be just running on a pump, which is one way to give it, or two, to push the fluids. So those are the two ways. We don't do wide open on kids and we don't do pressure bags on kids. But you can push fluids and you can run them on pumps. What I would tell you is definitely if a physician just gives you a verbal order, ask them. Ask them how fast they want it. It's possible that maybe if they're going to plan to give a couple fluid boluses on a kid, they want the first one pushed and the second one infused. So ask them how fast they want it. Definitely always do what your mark tells you to do, but one thing is you should probably question whether or not you should at least push some fluids. So I'm going to show you how to do the push-pull method, and that is to give kids fluids rapidly. Grab a normal bag of saline, prime it with your normal IV tubing to the end. Then you're going to grab a stopcock, which is kind of one of my favorite little tools. It's just kind of useful for a lot of different things. You're going to connect it to the end. We're going to pretend this baby has a scalp IV already established. And then you're going to grab a 20 ml syringe. So I would say a 20 ml syringe if you're going to use, if you're giving a 20 per kilo bolus. If you're just doing a 10 per kilo bolus, use a 10 ml syringe. It's just going to help you for math. So thinking through it, if you're going to give, if I'm using a 20 per kilo bolus and I have a 20 ml syringe, then I'm just going to give as many syringefuls as this kid is in kilos. So let's say this is a 2 kilo baby, it means I'm going to give 2 syringefuls. So you're going to hook your syringe up. Let's just say we're going to finish priming it, make sure that all the way the stopcock is primed. And you're going to literally connect it to you can connect it right directly to the IV. And you're going to turn your stopcock off to the patient first. And this is just so that you're not pulling back up blood and you're actually just pulling straight from your tubing. So I'm going to pull back my syringe. And you can see, like, I already am getting my syringe directly from the fluid. And then you're going to turn the stopcock off to the fluid so you can push it in your IV. And it's going to go right into the IV and give the kid the first bolus, first part of it. So like I said, we're going to give, this is a 2 kilo baby, so we need 2 syringefuls. So you're going to turn your stopcock back off to your baby. Pull back again for your fluids. Just turn that stopcock back and forth. So it'll say off. Just make sure it's just turned off to the direction that you're either pulling or pushing. So now turn it back off to the fluids, and now it's open to the patient, and I can give my second bolus. So now I've just given this kiddo a 20 per kilo bolus in a matter of a few seconds.
Give can't talk.